Hare Krishna. My name is Sundarananda, Dr. Sanjeev Agrawal, and I am the chair of the Bhaktivedanta Medical Association. I'd like to start by expressing my heartfelt gratitude to the senior devotees, the governing body commission of ISKCON, sannyasis, gurus, maharajas, and all other devotees and well-wishers who have given us the blessings to be able to start this very, very important service. I also want to extend my gratitude to the 140 plus members of this Bhaktivedanta Medical Association. These are the healthcare professional devotees who have come across and given their endless time to make this a success. So I'd like to start with giving a little background of this committee. So approximately 9 months ago, in June 2021, we were approached to create a global healthcare committee. We were asked to take a blank canvas and write on it. And what we have done in the 9 months is to create a virtual hospital where we can provide holistic healthcare to the devotees across the globe. We have, in these 9 months, come together and created a virtual hospital from where we can provide this service. We have got a vision of serving Chaitanya Mahaprabhu's mission and Srila Prabhupada's mission by serving the devotees in terms of providing holistic healthcare. And this is by the virtual hospital that we have created with a very strict governance structure. When we talk of the Bhaktivedanta Medical Association, we think of two things or two phrases. The first one is global healthcare, and the second one is holistic healthcare. When I say global, this committee is truly global. We've got members from America to Australia to New Zealand to Canada, Europe, including United Kingdom, India, South Africa, Singapore, and many, many countries. And all these devotee healthcare professionals have come together to form a team and a committee. And when I say holistic healthcare, that is the special point about this service, is this is truly holistic in nature. So we have got a structure where we have got the trustees, a trustee board. We've got an advisory board. Then I've got my executive committee. And then we've got 15 subcommittees. And these 15 subcommittees come together and provide a holistic service. So we've got a very strong Ayurvedic and homeopathic and naturopathic committee. We've got a diet and nutrition committee. We've got a yoga and physiotherapy and allied healthcare committee. We've got a preventative committee. We have got an emotional wellness committee and a mental wellness committee. And then we have got a very strong nursing committee too. And finally, we have a big allopathic committee, which then provides care from cradle to grave, which means that we've got neonatologists to end-of-life care physicians, the geriatricians, and in between all, we've got women and children section, and we have got all the subspecialties of the medical and surgical specialties. And these are all the doctors coming in these committees. And these committees are supported by a research and resource committee, which is again a very important part of the system. And this committee peer reviews all the articles that will go on the website for providing the education material. And when in due course, when the research will start, we will have a very strong research arm to it. Then we have a content and website committee. And this content committee is responsible for bringing all the content together and then publishing it on the website, which will be available to you now. Then finally, we have an ethics and governance committee, which is a very strong hub for this whole committee to ensure that this committee provides holistic healthcare in a very tight governance structure. So how are we going to provide healthcare to the devotees? And this will be done in two forms. One is education. So under the education arm, we will have articles which will go on the website in a very peer-reviewed way. Now, these articles will have holistic tinge to it, and that will be not just an allopathic component, but they'll also have Ayurvedic component. Will also have diet, nutrition, yoga, mental wellness, physiotherapy, all of them part of the same article so that viewers can get a holistic material. There'll be in the future videos, webinars, seminars, there'll be blogs and all other social media material. So that's about the education. Then the second component which will be starting in the future is direct medical care. This direct medical care will be provided by hitting a button on the website called a medical query button. The devotee patients will write their queries and will go to a primary care team, which will then either deal with this condition by themselves by providing a telemedicine consultation or pass it on to the specialist. Or it might be that it might be directed to a team member of the team of the mental wellness or emotional wellness or Ayurvedic committee, and they will deal with it accordingly. So obviously we are not starting that just yet, but it will be started in the future. So what are we expecting on the day of launch? We are expecting that there'll be the website, which will have all the information about who we are, what we are doing, and how we plan to do things. And there'll be a lot of education material in form of these articles. And please watch this space. This will grow in terms of more and more and more education material as the time goes on. It will be added, and will be all conditions will be covered. There'll be lots and lots of videos from different specialties and other social media stuff, and there'll be webinars, there'll be seminars conducted, and interviews, live interviews also. Then of course in the future the telemedicine consultation will start, and we will be able to provide a direct medical care to all the patients, all the devotee patients. So in this way, to summarize, this Bhaktivedanta Medical Association is a team of healthcare professionals across the globe which will provide holistic healthcare to the devotee patients globally. We, at this point of time, would like to seek the blessings of all the audience so that they can bless us, that we can continue to serve in this mood of humility and with best of our ability, so that healthcare can be provided to devotees across the world. Hare Krishna.